Thank you, Dan. So Claire and I are going to be speaking about green walking, green gyms and green spaces in acute mental health settings today. I'm the Sustainable Healthcare Delivery Lead and Allied Health Professions Lead at the Centre for Sustainable Healthcare. My background is as a mental health occupational therapist. I still currently work clinically 1 day a week for the crisis team in Brighton, who are based at Millview Hospital, where a lot of the work Claire is going to be talking about today has taken place. Claire, would you like to introduce yourself?
Hello everyone, I'm Claire Michie, so I'm professional lead occupational therapist and I work at Millview Hospital in Brighton and Hove for Sussex Partnership Trust, where I've been for about 10 years now. So yeah, good to be here. Nice to see so many of you joining us today.
Great. Thanks, Claire. So the main focus of the talk is going to be around green walking in mental health recovery, which is an initiative that the Centre for Sustainable Healthcare has been running for a number of years now. There's a QR code on the bottom of the screen, which will take through to our green walking web pages and link through to our green walking guide, which I'll be speaking about in more depth soon. So this initiative and the guide focus on developing green walking groups for psychiatric inpatients. And this is a photo from the back cover of the green walking guide. There are a number of issues with being an inpatient on the ward, including people having reduced access to therapeutic activities, limited opportunities to support physical health and activity. There's sometimes an unconsidered and excessive use of the Mental Health Act, which can lead to excessive detention and lack of supported leave for psychiatric inpatients, and often green space access can be overlooked, despite its value to support mental health well-being and recovery. And accessing green spaces can also ease difficulties that people may have with the transition between inpatient and community services upon discharge. So green walking groups can address issues in each of the problem areas I just mentioned. And put simply, a green walking group is about giving people an opportunity to move through a natural green space. Green walking groups provide respite and healing to people receiving inpatient care through walking together in nature. And these walks are easy to establish, safe and cheap. And they build on a significant existing body of evidence that has established the health and well-being benefits of green spaces and of walking. And this goes back to age-old knowledge about green spaces being integral to mental health, well-being and recovery. Another shift that we need in mental health services is the shift towards sustainable and holistic models of care. And in order to have sustainable healthcare, we need to have the triple win of protecting the planet, improving health and saving money. And sorry, I'll just go back to the previous slide. So this triple win is often referred to as the triple bottom line, because when we look at this equation of what the value of an outcome or an intervention or a service is, we can say it's equal to the outcomes over the costs or the impacts. And if we are able to improve outcomes for patients and for broader populations, whilst reducing the environmental, social and financial impacts, then we can improve the sustainable value of what we offer. And this equation is at the root of incorporating sustainability into quality improvement. And the aim of SUSQI is to deliver care in a way that maximises positive health outcomes and avoids both financial waste and harmful environmental impacts, whilst adding social value at every opportunity. And we can see that green walking fits very nicely with the aim of SUSQI. In the Green Walking Guide, the triple win of protecting the planet, improving health and saving money was outlined in these quotes. This is a screenshot from the guide. And yeah, I'll just let you read through those without reading it verbatim, but it's worth noting the social benefits that are there are social benefits for staff. Green walking doesn't just bring benefits to service users, it also brings benefits to the staff. And in the 4 principles of sustainable healthcare, which if you've been to other sessions this week, you will have probably heard. But if you haven't, the 4 principles in order of importance are prevention. The second is supported self-care or patient empowerment. The third is making pathways as lean and efficient as possible. And the fourth is choosing low carbon treatment alternatives. But prevention is the most important principle of sustainable clinical practice. And the fact that green walking contributes to people's recovery, it is included here in the financial section, but that obviously has environmental and social benefits too. So Centre for Sustainable Healthcare set up the Green Walking Initiative in 2018, and 8 sites were set up. This initiative was led by psychiatrist Jacob Krasnowski, who, with funding from the Network for Social Change and other people at CSH, recruited teams across 8 NHS mental health trusts to run a pilot scheme of new green walking groups for inpatients. And the wealth of benefits and first-hand knowledge from these Green Beacon sites informed the writing of the Green Walking in Mental Health Recovery, a guide. So this guide was endorsed by the Royal College of Psychiatrists, the Royal College of Occupational Therapists, the Royal College of Nursing, and the Maudsley Charity when it was launched in May 2020. There's a QR code there if anybody would like to link straight through to it. And this gives you an overview of what's included in the guide. So information about the initiative, the evidence base behind setting up the walks and why it's important to do so, what has been learned from those 8 Green Beacon sites, how to set up, establish and register your walking groups, and then various resources. And yeah, it's worth saying that Claire discovered this guide. Claire wasn't part of one of the 8 Green Beacon sites, but discovered this guide and then set up the walking groups off the back of the guide and has done some amazing work. So here are some quotes from the guide. And Adrian James, when we had our launch event, he was interviewed by the Iron newspaper and said that he would like to see green walking groups rolled out across all psychiatric inpatient units across the country. And that is something that we are working towards and seeking funding to support. So the occupational therapist on the left in the photo is Julie Delahaye, who was one of the people leading one of the Green Beacon sites and a female ward in Medway, Kent. And very quickly, green walking spread across the other 3 adult and 1 older person wards. And so they now have green walking groups included as business as usual across their hospitals in Canterbury, Dartford and Medway. 4 wards Canterbury, 3 wards Dartford, and 3 wards in Medway. And this is a set of photos that were taken on some of the walks that they were involved in. So I'm just going to play this, and I'm not going to spoil it by talking over it. A nice moment of calm. And yeah, I think it's really marked the difference in atmosphere of these walks compared to what inpatients usually have as part of their setting in an inpatient unit. So this is a slide from a presentation Julie did on the walks, and I'm just going to quote something that Julie wrote. So she said, "We didn't only choose informal patients, but saw an opportunity to positive risk take with patients detained under the Mental Health Act. Besides the usual benefits, for example, an increase in stamina and confidence and having an opportunity for conversation and peer support, nature has its own power of healing. When you enter the woods, you stop and are transfixed by its beauty. The chatter in your head stops, the tension falls from the shoulders, and the breath takes a more relaxed pace. The person behind the illness is revealed. We see the patient as a person, and they see us as people too. It's because we spend more time with them in a different environment. We just enable them, but they become the best that they can be." So, and I'm now going to hand over to Claire, who will tell you about the great work they've been doing in Brighton.
Thank you, Ben. What a lovely, moving quote that was as well. That was, yeah, lovely to hear. So yeah, just to tell you a little bit about what we've been doing at Millview Hospital in Brighton and Hove. So Ben and I made initial contact, I think, just before COVID hit, and joined the Green Walking networks and just really started hearing about this fantastic initiative going on in regards to green walking. So obviously during COVID, and or for all of us in acute services, really impacted on the group programs and activities we were able to offer. So we previously had a walking group, which was kind of a little bit of social prescribing as well, where we'd go to different places in the community and help kind of link people in. Obviously, all of those things closed during COVID. We found it a perfect time, really, just to review our programme and look at introducing green walking as a standalone intervention. So we kind of separated out the social prescribing bit, and I had to essentially put that on hold for some time. And we decided to develop a risk assessment and protocol for a green walking group. And as Ben mentioned, the guide was core to us doing that, really. So got together as a team of occupational therapists. So we have 5 wards at Millview, and a team of 10 occupational therapists and a mixture of OT support workers. So we developed our protocol, which highlighted the benefits and the aims of what that group would be. And we also developed some leaflets and some local maps to help support the groups that we were running. So next slide, please, Ben. So this is an example of one of the local maps we developed. So we're very lucky at Millview, actually. We do have some very lovely green walks within a very short distance, and even actually our grounds, our hospital grounds, have got some lovely green space. So this is an example, and during COVID, because we did have times where our staff were isolating, but not necessarily poorly, we had the time for people within the team to develop these lovely resources. So this is, yeah, an example, as you can see, of St Helens Park. It talks about how long that walk might take, what kind of facilities might be there, and then you've got the route and different walk options. So obviously we work with people with different physical and yeah, a range of different abilities. So we've had to make sure that we are able to grade our walks and that they're accessible to all of our client groups and patients, really. So that's one example. Next slide, please, Ben. And this is some images of some of the local walk areas. So we have a lovely windmill nearby. We've got Hove Park nearby. So yeah, lovely green spaces at our doorstep, really, which prior to really embedding this as a standalone group on all of our wards, we were kind of really missing that opportunity. Yeah, often as I say, our groups might have, yeah, not necessarily been in a nice green space, or most of it spent in the cafe. And of course, you know, that is a lovely reward sometimes at the end of a nice group, but it's definitely, you know, the quality and the benefits of what our patients are receiving since following the guide, I think, have increased significantly. Next slide, please, Ben. So as well as the green walking groups, which are now part of our core therapeutic programmes on all of our wards, we've also made efforts to increase our green spaces on the ward, and it's all kind of been inspired really through this work. So obviously for a lot of our patients in acute mental health who might be under section of the Mental Health Act, they might not have any leave from hospital for a while, for, you know, to maintain their safety, really. So we had a look at our ward gardens and really started to think about how we can improve those. There is research that shows even the view of a pleasant green space from your window within hospital can make a difference to somebody's recovery and length of stay. So it's quite significant. So we looked initially at our female wards. There was a lot of appetite for improving our therapeutic space. We have a fantastic consultant, Dr. Cuthbert, who's very active in terms of improving our sustainable healthcare and our therapeutic environment. So it took several years, as these things often do within the NHS, unfortunately, but we raised a significant amount of money. And that included MTT involvement. We had our lovely ward manager trying to, he hiked a mountain. He's also recently abseiled down the I-360 to raise money for an allotment we're trying to develop. So there's a real appetite within the MDT. And yes, we've developed a lovely therapeutic garden space on our female acute ward. So I'll show you some images of that in a moment, but it's got lovely raised flower beds, where we grow vegetables and herbs that we then use during our cooking groups. And it's just a really lovely space for people to go. So if I'm having a chat with somebody as part of an assessment, I don't have to be sat in a very clinical room that can be very daunting for people. We have a lovely natural therapeutic space outside where we can have those conversations. And we also raise money for our PQ, or psychiatric intensive care ward. And we have a lovely raised flower bed on that ward as well. And we've also introduced green gyms onto 2 of our wards, ward gardens so far, which was it was quite a big and brave step, really, because of the amount of risk management that's involved in that. So again, it took quite some time to work alongside our health and safety colleagues to develop risk assessments for that, but the benefits of it have just been really huge for patients to be able to go out into the natural green space in the garden and engage in physical activity. And we have developed, but we're yet to kind of confirm money, really, for raised flower beds on 2 of our other wards, and green gyms on other wards. So we're really aspiring to have that kind of fair access really to these interventions across our wards. Next slide, please, Ben. So this is a couple of images of our female ward therapeutic garden. Unfortunately, I don't have a before photo, but it really was just a kind of very barren concrete space. It was quite neglected, not very well used, and obviously not a very therapeutic space at all. So we worked with a wonderful charity, Breathing Spaces, who came and did the design and developed this with us. So you can see there on the left, the green gym, and we've got a lovely lavender path, some nice seating area. So when the weather is dry, we have a lot of our groups outside, not just kind of using the gym and walking. We'll do our community meetings, art groups, coffee mornings, yoga, as much as we can really in that space. Next slide, please, Ben. And those are some of the raised flower beds that we have. We have them all along the perimeter as well, some for herbs, and some that really bring that lovely sensory element as well, nice smells and colours. Next slide, please, Ben. And another event that took place recently. So we're very lucky to work alongside our sustainability colleagues. So Amy Bourne supported us with this. So we did some NHS forest planting within the hospital grounds. So 60 tree saplings were planted, and it was lovely that we had some patients from Millview that went out to attend, a wealth of volunteers, and that's just been fantastic in creating, biodiversity around the site, and we know the longer term benefits of that really. So that's been really positive. Just wanted to mention that. Next slide, please. So just a little summary then of the nature-based interventions that we are now offering within our hospital at Millview. So we've introduced gardening groups to all of our ward programmes, again as a core intervention. Some of our gardens have more access to outdoor raised beds than others, so some wards that might be indoor gardening that takes place, but that is a standard intervention. As I say, the green walking groups we now offer on all of our wards. We've also introduced a lovely Meet the Morning group on our older adult ward. So this is part of a QI project linked to improving sleep actually. But it's very much the aims of the group are about getting outdoors in nature and sunlight as early as possible in the day, and the impact that obviously has on our well-being, our circadian rhythms and recovery. Social prescribing, so we have just got that back up and running post-COVID, and green social prescribing is something we're really trying to actively promote. Our local Brighton and Hove health walks. I can see some questions popping up in the chat, which we will come to in just a few minutes, and making links with our local community garden, Plot 22, which is very nearby. We have the green gyms, as I say. We're trying to recruit a gym instructor who can actually come and help us utilise those to full capacity. And as I mentioned, during the dry weather, we really try and utilise our garden spaces for as many groups as possible to take those outdoors, and our cooking groups as well, using the things that we are growing in the gardens. Next slide, please, Ben. So I think this is my last slide before we go on to some questions. So in terms of what next then, so this is just the start really, but our aspiration within Sussex Partnership Trust is definitely to aspire for all of our inpatients to have access to regular green walking groups. So as a group of occupational therapy leads, we have met a couple of times, and I know there are new groups emerging and in planning stages on other wards, which is really positive. This also really aligns for occupational therapists with recovery through activity, which is an evidence-based OT intervention, and one of those core areas is around outdoors, the benefit of being outdoors. So we've developed a recovery through activity, which is more of a level 3 kind of higher level group to support recovery, focused on green spaces and being outdoors. Yeah, planned in motion for the green walking groups, and I know that Ben has much higher aspirations as well around how we link in with our community teams and think about that transition into the community, as well as then other kind of social prescribing within the voluntary sector. Yeah, to increase our social prescribing, we are only just really starting to build that back up, and we had a fantastic occupational therapy student actually recently who's done a wonderful amount of work setting up a lovely folder and a board and a lovely interest checklist actually, which includes some of the green social prescribing stuff available. So that feels like a really positive new initiative as well, which is really going to help. And moving towards a more MDT approach, so we've talked about this within our leadership meeting and therapeutic committee recently, and there's a real appetite for this. You know, not just having one walking group a week, but actually how patients can use their therapeutic leave or their Section 17 leave from hospital, not to go and smoke, which is what a lot of people do currently, but to actually use that to utilise the lovely green walks locally, which will benefit staff as well as patients. And just trying to improve the groups. You know, I would really advocate for the Green Walking Network. I've had lots of inspiration from that over the last few months in terms of making the walks more varied. So introducing photography, which you can then bring back those lovely images and put into the ward, which is a way of bringing green spaces into the hospital and some very clinical areas, which you saw from Ben's image of a ward at the start of the presentation. Things like the big garden bird watch, there's great free resources, foraged art, mindfulness as well, you know, just taking a moment to look around you and really tune in to 5 things you can see, 4 things you can hear, etc. And we're trying to recruit some gardening volunteers at the moment. I think as occupational therapists, we are known as jack of all trades, master of none. We're not necessarily experts in every intervention that we offer. So we're really trying to bring in that expertise to add to the value of the green walking groups. And as I say, we want to improve our gardens and our green gyms across all of the wards as we grow, really. So yeah, that's in a nutshell, that's kind of where we're at, what we've done and where we'd like to head. So now, and just to briefly say, actually I should have added a slide in on this, but you know, the feedback from patients who come along to the either the ward-based gardening groups, but particularly the green walking groups in the community, what an impact that has on their well-being and their hope and their ability to start looking to the future and life outside of the hospital that they might have been in for some time, and the knock-on effect that can really have to our patients' motivation and engagement with different types of interventions, because of the benefits they get from that, really. So yeah, that's from me. So I'll hand over back to Dan. I know lots of questions I think have come up in the chat while we were talking.
Sorry, there's a couple more slides, if that's all right, before we get to the Q&A, please, Dan. So yeah, I just want to thank you so much, Claire. It's been great seeing how this work has just really expanded and continues to expand. So Claire and I are both co-leads of the Mental Health Sustainability Network at CSH. There are over 30 different networks. Dan is involved with the Green Space for Health Network. We also have AHP networks and networks for specific AHPs, so the Art Drum Music Therapies Sustainability Network. There's been some great work done about nature-based art therapies, which the British Association of Art Therapists had a conference in November, and really just the day was focusing on therapies dealing with the climate crisis, and there was lots of great work being done around nature-based interventions there. So do get involved in the networks. All the networks are free to join, free to be part of, and all the networking events are free to be part of as well. We have a monthly networking group for people interested in setting up green walking groups. The focus is still on acute inpatient settings. As Claire said, we would like to see green walking become part of business as usual for all mental health services, from socially prescribing green walking in primary care right through to inpatients, all the community teams in between. But yeah, do come along if you would like to find out more or would like some support in setting up your green walking groups. And we also, next month, I will just put in the chat the link to our next Mental Health Susnet networking event, which is on the 22nd of May. And Stuart Darch-Smith, who took the photo of the inpatient ward that I showed earlier, he's going to be talking about RT Sykes Net Zero mental health care guidance and SUSQI. And if anybody would like to get in touch to ask anything else about green walking or the networks, my email address is there. I'll put it in the chat as well. And this is a photo from my local green walk that I love. And yeah, this is Castle Nature Reserve, just to the north of Brighton, and I walked 5k around there this morning. At CSH, we like the phrase green time before screen time, and so I'd strongly encourage everyone to explore that. Thank you.
Great, thank you so much, Ben and Claire. Really fantastic to find out more about the Green Walking Initiative and how even after the sort of the main funded project and the beacon sites that were involved, that it's continued to involve other trusts like the one that Claire works at, and it's sparked such a range of nature-based activities. It was, really fantastic to find out more about that. And also improving those spaces for nature, which is sort of my area of expertise. So I forgot to actually introduce myself at the start, I realised. So I'm Dan Lovard, and I also work at CSH, a colleague of Ben's, and I'm the Green Space for Health project lead. So yeah, the NHS forest that Claire mentioned earlier, that's a core part of the offer that we have within the team, and my session tomorrow that I'm delivering, I can talk more about that if you're interested. So